Hello, everyone. Happy Friday. I hope you're doing well today. I know it's early on a Friday. Just checking in. Okay, I can see the comments. So, hey guys, today, real quick, there's no slides for this conversation. There's, nothing kind of formal about. Um, our talk this morning. Just really wanted to connect with you all in the group and really talk about the pros and cons of diagnosis and diagnostic testing. So I use myself as an example for a lot of this, but being in this space, this is something that I get asked a lot. Um, this is a huge question for people that, are going through whether it's recognizing symptoms or trying to decide whether or not to seek a formal diagnosis. And diagnostic testing is also something that I get asked about quite frequently. So, I really just want to touch on the pros and cons of seeking a diagnosis using diagnostic testing and what we can do to support ourselves and to support forward progress, right? Because that's what it's all about. If we're not moving forward, we're going to keep ourselves stuck. So, without further ado, let's just talk about the diagnosis in general. So, for me personally, and I see this a lot in this space, um, and when you're searching for answers for chronic conditions or symptoms, um, it can be very challenging to navigate and figure it out. Sometimes you feel like your body's falling apart. You're not really sure where to turn. Maybe you've asked a doctor. Maybe you've gotten some labs and they look normal. But inside, you really know that something's wrong. Like there is a reason for the experience that you're having in your body, whether that be pain, whether it be tinnitus, whether it be joint or muscle stiffness and pain, digestive issues, skin issues, weight loss resistance. All of these things kind of play hand in hand. And we like to parse things out separately because that's how our medical system works these days. And there are pros and cons to that in itself. There are very specific. Sorry, I got a message and I think it threw everything off. There are uh, very specific things we focus on, but we miss the big picture sometimes, right? And that's actually what happened in my case. So, when you're looking for a diagnosis, and I'll just start with my personal experience, is it can be very challenging to even find the right person. So, when you're dealing with all of these mystery symptoms, a lot of the time we are essentially a pinball in the medical system. So, unless you've got something that is very specific, like, cardiac problems that a cardiologist can diagnose and treat and whatnot, it can be very difficult to find answers. So, what does that mean? You get lots of tests, you spend a lot of time. There's a lot of time spent just dealing with your symptoms and not really knowing where to go. Um, and you want answers, right? So I am not against seeking a diagnosis, okay? I am not against getting labs and running diagnostic testing. I think that they can be very enlightening, but they can also be the opposite. And we'll get into that a little bit later. But just back to my specific experience with receiving a diagnosis. So, for a long time, I did have chronic IBS, and that's been going on for over 20 years. And luckily, that is pretty much completely reversed. I very rarely have issues with that now, but it took me a very long time to realize how to change that, right? And to heal my gut and to start further healing in my body. Um, Early 20s, received the chronic migraine diagnosis. And even last year, actually about a year ago, May 2024, I received the trifecta: hypermobile Ehlers-Danlos syndrome, POTS, and MCAS, which is a whole lot of fun. And I'll tell you what, that diagnosis took me almost a year to get once I realized what I was looking for. So I spent several years with all of these mystery symptoms being bounced around from doctor to doctor. See a physical therapist, see a physiotherapist, see my PCP, see a rheumatologist, um, see the neurologist, functional medicine doctors. And nobody really put things together. I was actually getting some prolotherapy in my neck, seeing a specialist in Florida where he also specializes in hypermobile Ehlers-Danlos syndrome, where he said, if you don't have this, you're borderline, so you need to get checked out. So once I got home, that hunt took me almost a year, and I knew what I was looking for at that point. So that just goes to show that it can be really challenging, time consuming, frustrating, and financially expensive to find a diagnosis. Now, I'm not saying don't do that, but that's one of the things that we face when we're looking for answers, right? And I actually hired my own coach, Kelsey. She was amazing. And I worked with her for a few months last year. And she had asked me, what would change when you receive this diagnosis? And my thoughts then, because of the healing path that I was on, was honestly not much. But I had already started looking. I wanted the closure. So for many of us, getting that closure can be quite helpful. To know that the doctors that said, oh, you don't have that, you can roll that out, to know that essentially you're not crazy, and also to explain to family and friends that there is a reason behind what's going on. Now, there's a caveat to that. We may receive a diagnosis, but oftentimes, even in 2025, medical professionals still don't know exactly what's going on. And it's not necessarily their fault. It's just the science, as amazing as it is, isn't completely caught up yet, or it's faulty. There's missing pieces. And unfortunately, it's just the nature of the beast, right? So maybe you're in that boat. Maybe you're trying to figure out whether or not to get a diagnosis, and absolutely do what you need to do to manage your health. Okay. For me, that closure was important, but it did not change how I went about things. I actually did end up finding there is one specialist that specializes in my condition. Well, which I will get to that as well. With the diagnosis that I have been given. In the tri-state area, and she doesn't really take new patients. So I did see her 3 or 4 times, but I went into those conversations knowing that conventionally speaking, I wasn't really going to find answers. So it was really just more for information for me to see if there was anything that I was missing that could be useful. And I think she was great. She was very positive, which leads me to my next point. When you are seeking a diagnosis in the conventional space, you can get really lucky and find a doctor that is quite positive, that will listen to you, that will hear you. I know last week we talked about being heard and, not feeling seen when we're talking to our practitioners about what we're going through. And sometimes you're lucky. I found one finally that I felt seen and heard with, and I wanted to hear what she had to say. She was also very open. So I had spoken to the geneticist previously, and the geneticist, being a geneticist, was very closed-minded about the possibilities and healing potential of genetic conditions. Luckily, working with the practitioner that I found, she's very open, but she didn't have answers, but she was open. So basically, the long and the short of it is, there's so much that's attributed these days to genes, right? And oftentimes we are told or led to believe that our genes are the end all be all. But the one message that I want to share, if you take away anything from this, is that genes are only one small piece of the picture, right? It's been found in cancer, autoimmune disease, diabetes. Most, if not all, chronic conditions can only be attributed solely to genetics about 5 to 10% of the time, which is really low, which is huge. So, what does that mean? Our environment, our lifestyle, our nutrition, these are all things that help determine gene expression. So, it will determine whether or not those genes are turned on and off. And we oftentimes are not given that information, or we're not informed about it, explained that that's how things work. We're told it's genetic, it can't be reversed. Here you go, here's medications, here's physical therapy. You're going to have to live with this. I actually was sent home from an emergency room one time, and I was told this is just something you're going to have to learn to deal with, which was very disheartening. But that's how some practitioners work. And, that leads me to kind of my next point of conversation. Well, we'll skip that. We'll get back to that. Let's get into diagnostic testing real quick before we get into the mindset piece, because the mindset's the most important, and that's what I want to leave you with. Diagnostic testing. I personally am a data-driven individual. Okay. I'm formally trained in the biological sciences. I've worked in patient care and in both clinical and academic laboratories. It's how my brain works. I love information. I love data. I love to learn things. To me, lab work is super exciting. Okay. And for you, it might be as well. It might be very telling, but there are pros and cons, okay? Especially in the functional medicine space or the alternative medicine space, they go haywire with lab work. And trust me, when I first switched over to that space, I was all about it. Give me all the labs. I was concerned about some of the pricing, but I wanted to know what was going on, right? What I have found, and what many people find, is that the labs can be helpful and somewhat insightful, but they don't really give you a true direction on where to go. So it begs the question to be asked, should we be getting all these labs? Whether it be a gut microbiome test or a Dutch test or organic acids or all of the blood tests. And I think that it's really going to come down to, is this going to help guide my action? Because a lot of the things we test for can be resolved with nutrition, lifestyle changes. Okay. So I think that's important to note. A lot of the time we want to go in and get all these labs and say, okay, well, I can do this, 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 and this, and it's going to make everything better. But sometimes it doesn't. Sometimes the labs don't change. And sometimes the labs aren't completely correct. So let's take a heavy metal test, for example. I think they're interesting. I think they can be helpful. I have had a couple of myself before I realized the caveat. And it's great to know what is in the blood and in the urine. For me, arsenic was super high in my blood. It was off the charts, which was like, okay, well, let's kind of figure out where this is coming from. But it doesn't tell you what's in tissue. Okay. It only tells you what's circulating. Same with hormone tests. It only tells you what's happening at that point in time. We don't see trends. We just see a momentary piece. There are some physicians that will say, okay, well, your labs are your labs, and that's it. So they will either diagnose or completely, what's the word I'm looking for? Dismiss a diagnosis based on what your labs say. And there are other physicians that will say, well, you know what? The labs aren't completely accurate all the time. And they also they can be negative. But if you're symptomatic, then symptoms trump the labs, which if you're data driven, that doesn't really click sometimes, and it can be super frustrating. So those are, my thoughts on labs. I think if you want to have diagnostic testing run, I think it's very important to know, especially if you're paying out of pocket or you're looking for a diagnosis, is this going to change your treatment plan? Is this going to have an actual impact on how you move forward? Because if it's not, and you can move forward with diet and lifestyle and see how far that gets you, then that's the better option. And I think sometimes that's frustrating because we would rather get the labs, take a supplement, or change one small thing than change our nutrition and lifestyle as a whole. So, if you're with me, if you're getting all that, give me some fire in the chat. Tell me what you think. I see your comments coming in, so thank you. I'm glad that this is beneficial for you. The final thing that I want to get to, and this is the most important thing, is how we move through this. Okay, so when you have lab work or you have a diagnosis come through, what do we do with that information? And I was starting to go down this path a little bit ago, but in many cases, and what I've seen a lot of, is that receiving a diagnosis can not be beneficial. Okay, and here's why. I'm not saying don't get it. I'm saying if you get it, we have to move forward, right? All too often, a chronic illness diagnosis is handed off to someone and a couple of things happen. And you noticed me slip earlier, and this is something that I'm actively working on because, like I said, I just received 3 of my diagnoses last year. All right, so working to change my mindset and how I speak is part of this, right? So when we receive a diagnosis, we often take that on as an identity, right? We don't mean to. A lot of us, we would say we don't want our diagnosis to define us, right? But what you might find is yourself saying, well, my migraine, my condition, my this, my that, I can't do this because of X. And yes, we need to be aware of potentially physical limitations. If you're hypermobile or have hypermobility, you don't want to be doing things that are going to cause yourself to cause subluxations, dislocations, cause excess pain. But we often put ourselves in this box and say, well, I can't do X, Y, and Z because of this. We tend to avoid triggers and really just in general make our world really small. When what we need to do is expand our worlds so we can live our lives. After receiving the diagnosis of hypermobile Ehlers-Danlos, I joined a couple support groups, and one is paid for. And I think it can be beneficial, but eventually, after a couple months, I had to leave. And the reason why is because so many people get stuck in a negative downward spiral, and they live in their condition all the time. And what that does, when you have a mental state that's focused on pain and negativity, it continues to build pain and negativity. So, I have a challenging time with balancing support because oftentimes the groups that are there to support us, yes, it is there to go and vent and say, hey, I'm having a rough day, or, can anybody help with X, Y, Z? It's not all sunshine, rainbows, and butterflies. I get that. However, so many people live in that negative space and they use those groups as sounding boards to say, I can't do this. My life is limited by this. I'm having so much pain. And that is not to reduce what anybody is going through. Absolutely not. But if you're someone that doesn't want to live in that space constantly, I urge you to put yourself in a different mindset, in a different space, which means you're surrounding yourself by different people. If you want to learn about the name that your symptoms have been given, then absolutely, but try not to get stuck in that. Okay, so how we support our body healing starts with our mindset. And it's actually interesting, and I was shocked when she said this when I was speaking to the practitioner, the one practitioner in the tri-state area that focuses on connective tissue disorders. She had told me I'm better off than 80 to 90% of her patients, not because of my symptoms. It's not that my symptoms were not as bad or whatnot, but because of my mindset, right? So it was amazing to hear that even a physician say, listen, your mindset is doing 80% of the work. That's getting you to the place that you need to be. That's preventing a lot of your pain. And then of course, being motivated to make the lifestyle changes, to make the nutritional changes and stuff. So those are all of my thoughts. If nothing else, you leave here today knowing that mindset is going to be your most powerful tool on this journey. And you're going to have ups and downs, and there are going to be days where you just want somebody that understands and you want to go vent, and that's okay. But where you stay most of the time, do you pull yourself out of it, or is it a downward spiral that you're going to continue to live in? When we focus on something, that energy continues to follow us, right? So we can either focus on the things that we can't do or things that we perceive that we can't do, or we focus on the things that we can do, the things that we can have, the things that we can make. So while you're on this journey, just remember that that is a choice. A diagnosis is not yours. It is a name of symptoms that you are experiencing right now. And in most cases, you have the ability to change that, to get rid of them, to reverse your symptoms, to reverse your pain. There are some cases that are purely genetic, that 5 to 10%, right? But in the majority of cases, 90 to 95% of cases, we have the power to heal our bodies. Our body wants to heal. It's not attacking us. It's not against us. It's not falling apart as much as you may feel like it is right now. But the body, I don't believe that we were designed to live in pain and not heal. I think surgeons are amazing. Surgeons may stitch you up, but it's the body that heals. You can put a screw in, you can put bones back together, put a cast on. It's the body, though, that does the work. Humans, our job is to give the body what it needs, to set things in the right place, to set things in motion for what it needs and give it the support that it needs so it can heal. Okay? So we're at 23 minutes. I'm calling it a day. I hope that was beneficial for you guys. If you have any questions, let me know. If you're going through this, I totally understand. If you have any, thoughts, or you want to chat about mindset, or you're going through something and you really want to say like, hey, how do I overcome this? Please feel free to reach out to me, shoot me a message. And don't forget to catch the masterclass where we're going to touch on how we can reduce our symptoms, relieve pain, get off medications, even if you feel like you've tried everything. Because trust me, I've been there. I felt like I tried it all. I didn't feel like there were any answers until I finally found them. And I'm here to share those with you. So I hope you have a great day. Enjoy your weekend. If you're watching the replay, thank you. And I will talk to you later. Bye.